Secretary of Labor, Hilda Solis.
Thank you. Thank you, Roger, for that very kind introduction, and it's great to be here with the Campaign for America's Future. And yes, I do recall those days and conversations when I was about to step foot here in the Capitol in the hallways, and remember very vividly those progressives that met me and were just so supportive of the types of ideas and ideals that I and them, you, share. And that's hopefully to make our planet safer, greener, healthier, and now with this new movement for health reform, it will become a reality for us. I'm here really just to tell you that as someone who's also working in the administration, while healthcare is not my major focus, as you know, now it's about putting people's lives back to work and helping those individuals that are in need of education and training. And for the first 100 days into this administration, I have to tell you something. I feel so good being at this end of the table, because for 8 long years, you and I and the American public and the whole planet has been looking for leadership in our country and in the Congress. And finally, we have a president who doesn't have to be told and tutored and explained to why it's just to have reform in healthcare to provide coverage for 46 million and growing number of people, and why it's important to provide coverage for children and for the elderly and to continue to expand that safety net. Here's a person who really gets it, who really believes in his heart that there's a way to do this and there has to be a political will. And that will isn't so much in this room, it's really outside. It's convincing other people that this can happen. And in the first 100 days of the administration, just to tell you what I've already seen has just been incredible. No time in our history have people been hurting more than now, since the Great Depression. And as reference, Francis Perkins really made some remarkable changes behind the scenes with Franklin Delano Roosevelt, and I'm reading her book now that was just issued regarding her background. The challenges, the times were very hard, but the issues have not changed. In these years, we see a continuing high rate of unemployment, 5.7 million and growing of unemployed. In the African American community, you see upwards of 15% unemployment. In the Hispanic community, it's 11%. With youth, 22%. We're talking about people who have been dislocated from their work for over possibly 2 years now. So we're talking about some incredible pressures that are being placed on all of us. And in particular, our businesses, our communities, all those things that we know have been there for us are not there. Even our pension plans, our retirement plans, which is a big part of the role that I play in the Department of Labor, making sure that there is some semblance of security for people. And all I can tell you is, on my behalf, I'm going to work very hard to see that we provide incentives. First of all, that we have more people getting into the healthcare industry. And some of you in the audience know we've been working for many, many years to expand those tools necessary for prevention. And I'm talking in particular about legislation that I worked on as a member of the House on healthcare disparities and trying to bridge that gap. And that's an important part, I think, of the discussion in healthcare reform. And our president has been a champion on that issue as well. So he's not new to any of these issues that we in the Congress had been working on. Trying to curtail and really provide more preventive measures is going to bring down the total cost for health care. So that's number one. Let's address all those chronic illnesses that afflict all our communities that we know, if addressed appropriately, can be reduced dramatically. One of the things that I've become more keenly aware of is the shortage of healthcare professionals at the entry level. And this means those people that may be interested now in getting into the allied health careers, nursing careers, and then also hopefully encouraging our young people to invest and stay in our communities. And that means incentivizing them, but giving them the opportunity to, first of all, have a fighting chance to get into these careers. So to me, that's very important. In my budget for this year, for the recovery efforts, we have $250 million. Some may say that isn't a lot, but it is a start. At least it's a down payment to start investing in health careers. And my hope is to cast that net wide so that we get all the stakeholders involved in the distribution of that money. It's time to make sure that everybody that needs this opportunity is at the table. So that's what I'm doing, making sure that the solicitation of these grants that go out throughout the country, make sure that we hit those targeted areas that are underserved, that are heavily populated but have no form of accessible health care. That's number one, make an investment in our human resource. So that's a priority for this administration and for the Department of Labor. I also want to say that because of my role overseeing the pension plans and ERISA and all the things that help to safeguard those protections for our workers and people, we're going to have to be more vigilant. We're going to have to provide more oversight, more monitoring, and penalties to folks that don't play by the rules. So I'm very excited, very excited. Lastly, I would just say to you, because I have 1 minute, is that, it's about change, and it's about helping to remember that change comes slow sometimes. Sometimes when we least expect it, though, you have to take that opportunity. I would just say to you that we really have to work on members of the House and in the Senate, and again, the public. The public is what the mighty piece out there that we still have to tame, and we have to say, look, these are things, these are options that we have to pursue. And I know, like you, the public is ready for this. They're ready for this health care reform. And now's the time to strike and to support our president and to allow for opportunity for a very, very open and robust discussion about health care reform. I know that our community wants it. I know that I'll be out there advocating and pressing as many people as I can to support the kind of innovative ideas that come out of organizations like this, as well as our members of the House and obviously the White House. So I'm looking forward to that. And I just want to say thank you for the invitation. I know that as Labor Secretary, this is a jump from health care, but know that I do care about the quality of our human resource. And those are the people that we're going to employ in this industry. So I look forward to working with the private sector, with public sector, developing those partnerships and making sure that underrepresented communities are a part and are stakeholders in this discussion. So thank you very much for having me.